Hey, what's up, Unbroken Nation? I would love to know what those are because knowing that this is primarily something that is a conversation geared towards mental health, how do you know? Because I think there's red flags that you may notice within yourself that could be a causation of going, okay, there might be something here about me that I actually really need to like suss out. What would you
Mm.
consider to be a red flag?
Oh, from a patient standpoint, I would say maybe multiple joint pain. Like it may not seem like a big deal, but just like some overall stiffness. So people with anxiety and often in depression too will really be limited at their necks. And so there'll be some limited neck range of motion, but but that in itself is not necessarily a red flag. It's really about the combination of things. So if your neck is tight and you're feeling like it can be hard to get a breath, or like you have times where you're short of breath and you're otherwise healthy, you're not somebody that has asthma, or you're too young for and healthy for heart disease. This is a difficult, I'll say, I haven't really framed it this way. I take people, I know we're on video. I could take people, I can demonstrate some of the tests, like the self-assessment that I have people go through, but it's really about how you rotate. So it can be as simple as turning your head side to side and seeing how far you can go. If you can turn your head comfortably to one side and then bring your ear towards your chest in that position, you should be able to flex forward 45 or 50 degrees. If you hit a brick wall right at the top and you can barely bring your ear towards your chest, that would be one small red flag or maybe one yellow flag. And then if you're looking at shoulder motion, like you can if you put your arms up like goalposts and rotate them down, you should be able to go about 70 degrees on each side and without bringing your shoulder blades up over the tops of your shoulders. And if you're not able to, if you're only rotating 20 or 30 degrees down and you don't have any shoulder pathology going on, I would consider that another red flag. If you give yourself a hug and with your weight really even on your sit bones and rotate your body side to side, you should be able to go at least 45 degrees. 60 degrees is considered normal, but I don't fuss too hard over 45 degrees. But if you are really having a hard time rotating in those directions, that is one way. Perhaps the easiest way to really self-assess this though is through breath. And so even if you just put one hand, I'll have you do this and you can tell me how you feel with it. But if you put one hand over your heart and take the other hand and try to put it on the backside of your ribs. If you can get it to the backside of your heart, that's great. So just like the backside of your hand, and take a deep breath. Take a couple deep breaths in that position. And tell me, so do you feel how your ribs move your hand on the front of your chest when you
Yes.
breathe? What
Mhm.
happens to your ribs on the back with your backhand?
They're also moving.
Okay, good. So a lot of people don't expand their ribs on the backside of their chest at all, like on the
Yeah, and they're
backside of their ribs.
shallow breathing. And so
It is. It's shallow breathing, it's upper chest breathing, and it's no back breathing at all.
So the way that I discovered that, for lack of a better term, my vagus nerve was out of whack was because I actually could not take a diaphragmatic breath,
Mm.
meaning the biggest breath that I could take, excuse me, was less than 2 seconds as an inhale. And in that time, it freaked me out really bad because I knew that I was under this immense amount of stress. And I knew that my life was chaotic at the time. And I just uprooted myself and I travel across the world. And I was in this place where I was new and unfamiliar and stepping into a new trajectory and understanding and working through and navigating trauma. And I recognized one day, I was like, I can't breathe. And it was one of the most terrifying experiences that I had. On the backside of that, it lasted for 7 months. So, someone listening right now, I know without question cannot take that breath. And all of the signs, just based off of the self assessment, probably point to the idea that something is awry. How do you step into this place where you start to rectify and get back to what we would call normality or baseline in consideration of our human body?
At the very basic level, I think there are very simple breathing exercises you can do to give your vagus nerve more space. And really just paying attention to your breath, practicing breathing can be a huge thing. Going back quickly to what you were saying about your limitation inhaling, I guess for me that shows up more. I note more limitations exhaling. I find people's exhalations because their lungs are overinflated. I think it's at some level, but in terms of just getting, the first step is really just to have a conversation with your body and to learn how your body says yes and how your body says no. Because by the time you're in any kind of physical pain or anxiety or trauma response, your body is screaming no. And we do not have a language for communicating with our bodies. And I think really just tapping in and knowing that and not dismissing your body, as your mind is a very slippery liar. Your body really holds your truth.